Good morning and good day. My name is Dr. El-koha. Today's presentation will focus on the establishment of an oncology center in Pietermaritzburg, South Africa. The presentation will provide the following agenda: executive summary, company description, management summary, industry background, competitive analysis, market analysis, marketing plan, operation plan, financial plan. This slide starts with an introduction, and for the establishment of oncology center in Pietermaritzburg, this is a proposal, or this proposal is aimed at starting oncology center in Pietermaritzburg, South Africa, and the aim of this project is to address the growing need for specialized cancer care services in the region. The oncology center will provide comprehensive cancer diagnosis, treatment, and support services to the residents of Pietermaritzburg and surrounding area. This summary highlights the key components of the proposed center along with detailed costing analysis. Pietermaritzburg is located in the KwaZulu-Natal province of South Africa, and currently there is shortage of dedicated private oncology centers. Patients in need of cancer treatment often have to travel long distances, resulting in additional physical and emotional stress. With a population of over 600,000 people and an increasing incidence of cancer cases, there is significant demand for this project, or for an accessible state-of-art oncology center in the region. By establishing such center, we can provide timely and high-quality care to patients while also alleviating the burden on existing healthcare facilities. The services offered in such state-of-art center includes cancer screening and diagnosis, medical oncology services, where experienced oncologists will provide chemotherapy, immunotherapy, and therapy treatments. Radiation oncology services. The center will be equipped with advanced radiation therapy equipment, including linear accelerators to deliver precise and effective radiation treatments. Surgical oncology services, where surgeons who are highly specialized and experienced will perform complex cancer surgeries, including minimal invasive and robotic procedures. And also the services will include supportive and palliative care services, as part of holistic approach to cancer treatment and care. This includes palliative care, pain management, psychological support, nutrition counseling, and survival programs. This slide outlines the costs, and costs here include infrastructure, equipment, staffing and human resources, operational expenses, and marketing promotions. All these costs are estimated from the South African market, and infrastructure equipment, for example, estimated at a cost of $7,500,000. Staffing and human resource salaries or annual cost approximately $6 million per year. Operational expenses up to $1 million annually, and marketing promotion $200,000 annually. The company description is called or known as El-koha Holding, which is an experienced group of oncologists with more than 20 years experience in providing high-quality oncology services in different places or countries, including South Africa, Libya, and UAE. Um, the vision of El-koha Folding is to provide high quality oncology care, and our mission is a range of services as outlined in previous slides, and again includes cancer screening and diagnosis with early detection programs, the diagnostic services like imaging, biopsy, and pathology, medical oncology, radiation oncology, surgical oncology services, as well as supportive care treatments. The leadership structure will include the CEO, managing director, who is responsible for overall strategic plans, financial management, and operational oversight, and medical director leads the clinical operations, ensures quality patient care, and oversees medical staff, and administrative director with management roles or functions including finance and human resources and regulatory compliance. The management structure as well includes finance manager, operation manager, HR manager, and marketing manager with different roles and duties as outlined in the slides. Stakeholder definition, role and corporate culture is also a critical and important part in the establishment of the oncology center, and shareholders comprise individuals, investors, organizations, and strategic partners. Strategic guidance, financial support, and governance, and corporate values include patient-centered care, excellence, collaboration, teamwork, respect, community engagement, innovation, research, sustainability, emphasis on continued education, training and development, and succession plans. The background of the healthcare industry in South Africa. Healthcare expenditure in South Africa amounting of more than 5 billion rand a year is roughly evenly split between public and private healthcare sectors. Despite the former providing care of 85% of South Africans, palliative or private healthcare bounced back in 2021 and 2022 to pre-COVID performance levels. Public healthcare, already under strain from lack of resources and sub-quality care, struggled to cope with services provision during the pandemic. Healthcare funding concerns are increasing and public healthcare budget cuts are expected. Rising private healthcare costs are causing a reduction in the already small pool of medically insured people. Government expects national health insurance to fund over 90% of healthcare, but there are huge concerns. And 85% of South Africans have access to public services, whereas the lower percentage of population access private care treatments, and that might be attributed to the shortage of institutions. Competitive analysis. Here we will talk about strengths, weaknesses, opportunities, and threats. The strengths of establishing this center include its high quality, sustainable development, public health care prioritized. There are gains against HIV and TB treatments and resilience post-COVID. Weaknesses. South African healthcare system is characterized by extreme inequality of access. 85% population have no form of medical insurance and cannot afford private hospital care. There is progress towards universal healthcare coverage but has slowed down in recent years. The private hospital market is highly concentrated and dominated by three players in the region or three centers. Private healthcare costs are high, escalating ahead of inflation. Public health management is generally ineffective. There is excessive bureaucracy, and service delivery is poor. There are critical staff shortages across all disciplines in the public health system, where conditions are challenging, morale is low, and working hours are long. The retention of healthcare practitioners is challenged. Inadequate infrastructure, poor maintenance, and lack of basic um, services such as waste removal. There's an opportunity in establishing such project, and this includes implementation of national health insurance offers, opportunities for lower healthcare costs, greater universal health coverage, and more public-private collaboration, local and regional research and development interventions, including the development of health apps, the provision of public and private mental health facilities and services, the development of training health practitioners. There were threats as well, and this include COVID-19, climate change, national health insurance could be a tax burden, budget constraints, industrial action. The threat of cybersecurity breaches is increasing with the development of digitalized health systems, as well as inadequate infrastructure and poor maintenance and lack of basic services. Hello? Salam? خلاص بنمشي تنزل طول يجيك اللي بعده على اليسار، الشارع الواسع اللي بعده على اليسار تخش منه من قبل محل البركة. محل البركة تخش منه الشارع من قبل البركة. وبعدين تخش طول آخر فرش على اليسار تخش على البركة. The analysis of competitive analysis continued here, and this slide shows the competitive outlook. Risk and mitigation include, as outlined in the previous slides. So marketing analysis, there's limited availability of oncology centers in the province, high cancer incidence and mortality rates, delays of diagnosis and treatment, patient discomfort, distress with long travel distances, 500,000 people in urban and rural communities. Cancer incidence rates are increased and influenced by different factors like lifestyle, genetics, environmental exposures, and there is well-developed healthcare infrastructure, including public and private hospitals in the province, and also need to establish strong referral networks crucial for oncology centers. The marketing plan, there are three competitors in the area. Competitor analysis, three major competitors in the area have been analyzed. There is strong online presence, physician referral program, community outreach program, patient experience enhancement, monitoring, and evaluation. The operational plan services. Hello. And the operational plan include service offering, cancer screening, medical oncology, radiation oncology, and supportive care services. The startup plan include secure funding and obtain lease, purchase, renovation, appoint team, licenses, and also obtain partnership and marketings. The expansion phase include new treatment modalities, specialized clinics, collaboration with university, set up referral network for new business. This slide shows the organogram structure from the CEO, medical department, admin operations, community engagement, and support services. The land and building or the operation plan starts with getting the land and start building, getting plans with location, zoning, treatment rooms, consultation rooms, administrative areas, waiting areas, parking areas, amenities, supportive services, infrastructure, utilities, safety and security, patient experience, and expansion. The operational plan capital expenditures also include the fixed assets, such as equipment, treatment, diagnostic, laboratory, and surgical monitor equipment, furniture, IT infrastructures, office equipment, safety and security access, and medical consumables. Hello. لا امشي طول. The operational plan also include the capital expenditures, terms and conditions, warranties, and guarantees, terms and conditions like approvals, budget allocations, vendor sections, compliance, and regulations, and warranties of equipment, performance, installation, and software services. The production process and services include the production services, the support